Boston. Both short and long surgical incisions for cesarean births are associated with increased pain after delivery, suggests a study being presented at the Anesthesiology 2017 annual meeting. Based on the findings, the authors recommend an optimal range for cesarean incision length to be between 12 and 17 centimeters, about 4.5–6.5 inches, and advise that neither shorter nor longer incisions be performed when possible. To our knowledge, this Goldilocks effect of surgical incision length on pain outcomes has not been previously reported, and merits further investigation to unravel the effects of short-term tissue stretch and increased tissue trauma on acute and chronic post-cesarean pain, said lead researcher Ruth Landau, MD, Associate Director of Obstetric Anesthesia and Director of the Center for Precision Medicine and Anesthesiology at Columbia University Medical Center in New York. We were surprised to find tremendous variability in surgical incision length. While the median length was 15 centimeters, the range was from 9 to 23 centimeters, which may in part be due to the surgeon's practice and patient's body characteristics. The study included 690 women undergoing elective cesarean delivery, of which 37% had a repeat cesarean, who were evaluated preoperatively and followed for up to 12 months. Both the shorter and longer extremes of surgical incision length were associated with increased pain. Women with shorter incisions less than 12 centimeters or about 4.5 inches were more likely to report higher pain scores immediately after delivery, which, according to the authors, likely indicates intense tissue stretching during delivery. Women with longer incisions more than 17 centimeters or about 6.5 inches were also more likely to report higher pain scores, including wound hyperalgesia, or an increased sensitivity to pain around the surgical incision. Consistent with the researchers' previous work, chronic pain after cesarean delivery was extremely rare, with less than 3% of women reporting chronic pain 1 year after their cesarean delivery. Among those who underwent a repeat cesarean, chronic pain was reported by 12 of them, compared to 7 of the women who had a cesarean for the first time, 4.7% versus 1.6%. Overall, at 1 year, surgical-related pain symptoms, mostly described as tender pain, were reported by 4.7% of women, and neuropathic symptoms such as itching, tingling or numbing were reported by 19%. The multi-center study evaluated numerous factors including the influence of ethnicity, body mass index (BMI), psychological parameters and previous scar characteristics for women with the prior cesarean delivery as well as current wound characteristics. The study found that while women with a high BMI were more likely to have a longer surgical incision, not all women with longer surgical incisions were obese. Cesarean section is a unique surgical model, because obstetricians may perform the exact same surgical procedure repeatedly on the same woman. Therefore, studies that identify the ideal length of surgical incision in cesareans, taking into account women's body build and previous scar, if present, are important, Dr. Landau said. Furthermore, studies that evaluate whether persistent neuropathic pain symptoms from a previous cesarean are associated with a worse pain experience in a following cesarean delivery may provide insights about mechanisms that prevent normal healing in the transition from acute to chronic pain. The American Society of Anesthesiologists, founded in 1905, the American Society of Anesthesiologists (ASA) is an educational, research and scientific society with more than 52,000 members organized to raise and maintain the standards of the medical practice of anesthesiology. ASA is committed to ensuring physician anesthesiologists evaluate and supervise the medical care of patients before, during and after surgery to provide the highest quality and safest care every patient deserves. For more information on the field of anesthesiology, visit the American Society of Anesthesiologists online at asaahq.org. To learn more about the role physician anesthesiologists play in ensuring patient safety, visit asahq.org when seconds count. Join the Anesthesiology 2017 social conversation today. Like ASA on Facebook, follow ASA Lifeline on Twitter and use the hashtag ANES17. Disclaimer: AAAS and Eureka Alert are not responsible for the accuracy of news releases posted to Eureka Alert by contributing institutions or for the use of any information through the Eureka Alert system.